Looking at one of our first measures of protein, we see our total protein amount will measure both serum albumin and globulins. Albumin is synthesized in the liver and it accounts for the majority of total protein in the serum. And globulins are synthesized primarily by our reticuloendothelial system, right? Immune globulins, Igs, or antibodies, but also there are some synthesized in the liver. There are no known pathologic conditions that are associated with an increase in albumin. So really if we're looking at an increase in total protein, it's either due to dehydration or globulin increase. Now, it can be helpful to diagnose and to use this value to monitor liver dysfunction, nutritional status, chronic edema, systems of the immune or disorders of the immune system, certain collagen vascular diseases like lupus, or protein wasting from kidneys and intestines, which kind of couples into cancer patients and monitoring during treatment. A total protein value that's considered normal is listed here. Interfering factors could be a prolonged tourniquet application. That's why that 1 minute or less is really important with a 2 minute rest for the arm. Certain drugs can increase or decrease. And then, of course, hydration status. Looking closely then at albumin, this is synthesized only in the liver. Therefore, it's reflecting a functional reserve of the liver itself, and it can be a good measure or indirect measure of hepatic or liver function. It maintains our vascular colloidal oncotic pressure, the pulling back pressure of our blood vessels, and it's really important to transport protein for drugs, hormones, enzymes, calcium, etc. And the normal values are listed here. When we see decreased levels, we get concerned about the liver being able to create it. So we look at liver disease or protein losing conditions like Crohn's disease or celiac sprue, nephrotic syndrome where we are losing protein in the urine, ascites, or even severe burns. In decreased levels, we would also potentially be looking at increased capillary permeability like lupus, overhydration, inflammation, familial idiopathic dysproteinemia, or even malnutrition. Looking then at our other protein, globulins, we can see that they form the building block of our antibodies, glycoproteins, lipoproteins, clotting factors, and acute phase reactants. So they're quite busy. The serum globulin level reflects the damage of the reticular endothelial system in the liver. And our alpha and beta globulins are synthesized by the liver. Gamma globulins are synthesized by white blood cells, and a normal globulin value is listed here. And we can kind of see the difference in the different in concentration from albumin to these others. So when we look at our globulin, our IgGs, if we have increased levels, we can see that with cancers, inflammation, chronic inflammatory diseases, liver disease, infectious disease, dehydration. Decreased levels could be a genetic or an immune disorder that inhibits or prohibits the production of antibodies, secondary immune deficiencies, and there's some listed here, or potentially overhydration. When we look at the ratio then, we can look at our ratio of albumin to globulin, and there's a normal value here, which is greater than 1. So again, albumin should be much greater than globulin. When we see a decreased ratio, we see this in conditions where albumin decreases or globulin increases. For instance, in lupus, albumin is lost from the blood vessels due to decreased capillary permeability, but globulins are too large to cross, so the albumin globulin ratio will decrease. When we come back, we will look at bilirubin, which is a function and measurement of liver and gallbladder.